Hello and Assalamu alaikum. Ultrascan Diagnostics. This is the CBCT of the patient that you had requested. The area of interest is the lower left first and second molar. We can see on the 3D rendering that we have BDRs present. The 6 BDR shows insignificant bone loss, whereas the 7 mesial BDR shows a cortical perforation in this region as well. Moving to the panoramic view, on the panoramic view, we can see both the roots have been root canal treated. The crown structure is absolutely missing, and we can see BDRs present within the bone. The periapical radiolucency is quite significant around the second molar, whereas it is insignificant around the first molar. Taking you to the transaxial view. The transaxial view is actually the proximal view, and we can zoom in for our kind doctor. This is the transaxial view of the first molar. This is the mesial root. We can see that the mesial root has gutta percha present in it. We've got slight radiolucency or hypodense area that can be seen in the apical region below the apex of the root. The inferior alveolar nerve is quite significantly far away. This is the interdental area, interradicular area, whereas this is the distal root present, which shows no significant periapical pathologies. Moving to the second molar, the mesial root shows that it is quite significant. The bone loss of the buccal and the apical to the apex, we can see that there is a periapical radiolucency present. Moving to the distal root also shows that it has good buccal and lingual cortical plate. However, there is a periapical radiolucency present, or a hypodense area can be seen. The inferior alveolar nerve is again significantly far away. Now we are going to show you the tooth from an apical point of view. On the apical point of view, we can see that this is the lower left region. The cortical plate on the buccal side of the first molar is significant, whereas we do see the lingual cortical plate is slightly inferior. We can see a very clear radiolucency around the lower left second molar, which is perforating the buccal as well as the lingual cortical plates. We also see a slight crack in the interradicular area in this region. Now, our kind doctor has requested a megagen implant placement, which we will show next. This is the ideal area where, after the extraction of the BDRs of the first molar, we will have adequate bone where implant can be placed interradically. At the crest, we will have approximately 9.2 millimeters of width, and we will have approximately 14 millimeters of distance till the inferior alveolar nerve. Now moving to the second molar, this is going to be a slightly more trickier region because of the radiolucency. So we will have to navigate the placement of the implant slight distally. But at this point, the ridge width approximately is 9 millimeters, and the ridge height to the inferior alveolar nerve is approximately 13 millimeters. Now, these two implants have been placed for our kind doctor. The ideal implant placement location, according to our CBCT, is going to be on the sixth region. It is going to be a 4.5, 4.9, which is 5 millimeters and 11.5 in length, whereas in the 7 or the distal region, we can place again a 4.9 and a 10 millimeter implant. Now, these are megagen implants which the doctor has requested. The width can be narrowed to 4.5 and can be even 4, but that would be significantly less. A 4.5 or a 5 millimeter diameter implant can easily be placed. If we see on the 3D rendering that it will cover adequate bone in this region. If we look at the tooth from an axial point of view, we can see that the implant placement can be done in the center of the ridge without compromising the integrity of the implant. So an implant planning report will also be forwarded, but if there are any further questions regarding this case, please feel free to reach to our team and we would be happy to help. Thank you very much.